Hello everyone, I'm Dr. Tanisha. Today I'm going to talk about medical nutrition therapy in pregnancy. What is MNT? It is a carbohydrate controlled meal plan that provides optimal nutrition with appropriate weight gain, normoglycemia, and absence of ketosis. Individualized food plan based on basal metabolic index, BMR, physical activity level, glucose levels, personal and cultural eating habits, and expected physiological effects of pregnancy on women and fetus. MNT goals: achieve normoglycemia, prevent ketosis, provide adequate weight gain, contribute to fetal well-being. What is the nutrition plan in MNT? Calorie allotment, calorie distribution, and carbohydrate intake. Equations proposed by ICMR expert group to calculate adult energy requirement. Then how will we calculate energy requirement? It is calculated as basal metabolic rate multiplied by physical activity level plus 350 kilocalories, which is extra for the pregnancy. So how do we calculate basal metabolic rate? It is calculated, it is taken as 18 to for age group 18 to 30 years. We will calculate as 14 into weight in kg plus 471, and if the age is between 30 to 60 years, then we will calculate as 8.3 into weight in kg plus 788. Level of activity, physical activity value: sedentary worker, it is 1.53, moderate worker, it is 1.8, heavy worker, it is 2.3. An addition of 350 kilocalories can be made after calculating the energy requirement for adults. We are adding 350 kilocalories extra for the pregnancy requirement. Planned physical activity should be 30 minutes daily, and it should be done 5 times in a week, making 150 minutes in a week. Physical activity improves metabolic control, reduces insulin resistance by increasing the peripheral tissue sensitivity to insulin and insulin production by the pancreas. It reduces the cardiovascular risk factors, and it improves the weight gain. And we should always calculate and always take pre-pregnancy weight while calculating the BMI. And so normal weight, if BMI person whose BMI is between 18.5 to 24.9, the weight gain in pregnancy should be around 11.5 to 16 kg. If she is underweight, that is BMI is less than 18.5, then the weight gain should be between 12.5 to 18 kg. And if she is overweight, that is 25 to 29.9, then the weight gain in pregnancy should be 7 to 11.5 kg. And if she is obese, that is BMI is more than 30, then weight gain in pregnancy should be around 5 to 9 kg. Calorie intake based on pre-pregnancy and desirable weight gain. Underweight women, it is 35 to 40 kilocalorie per kg, and normal weight, that is if the BMI is between 18.5 to 24.5, then she should take 30 to 35 kilocalorie per kg. And if she is overweight, that is BMI is more than 25 kg per meter square, then she should take 25 to 30 kilocalorie per kg. Minimum 175 gram per day, and it should be divided in 3 meals and 3 snacks, that is 3 major meals and 3 minor meals a diabetic patient should take. The recommended composition of the GDM mother, that is gestational diabetes mother, gestational diabetes mellitus mother diet, is 50 to 60% should be calories come from the carbohydrate, 10 to 20% from the protein, and 20 to 30% from the fat, and saturated fat should be less than 10%. And carbohydrate and protein, it gives 4 kilocalorie per gram, and 1 gram of fat gives 9 kilocalories. The total intake of carbohydrate should be controlled and monitored. Carbohydrate foods with a lower glycemic index and complex carbohydrate like whole grain, pure vegetables should be emphasized. Saturated fat should be less than 10% of total calories, and dietary cholesterol should be less than 300 milligram per day. Protein requirement in pregnancy is increased, additional 23 gram per day. At least 3 serving of protein foods are required every day, and 5 high fiber foods, especially soluble fiber, may help control blood sugar. The meal composition, breakfast. Now we are talking about what should be the meal composition, like breakfast, what should be in lunch, and what should be in dinner, and what should be in snacks. Okay, then first breakfast. 10 to 20% of the total calories should be included in the breakfast. She should never skip her breakfast. Breakfast should consist of 1 to 2 carbohydrate servings like chapati, dalia, sandwich, poha, 2 to 3 idlis, etc., along with one serving from the protein-rich foods. Lunch, 20 to 30% of total calories. Dinner is 30 to 40% of total calories, and snacks 30% of the total calories, and each snack 10%. Like if we are taking 3 minor meals, which are the snacks, one snack should consist of 10%, and if you are taking it 3 times, then total making it of 30%. Lunch dinner, one serving. Lunch dinner we should take 20 to 30% or 30 to 40%, and 2 to 3 serving we should take in lunch or dinner, and one serve is making of 15 grams, that is around 45 grams we are taking at lunch and dinner, and 1 to 2 serves at breakfast and 1 serve for snacks. And now this is the, as per the government of India, this is plate meal method. Like we are taking a thali which of 9 to 10 inch thali we are taking, and half of the thali should contain vegetables that could be cooked as well as in form of the salad uncooked, and 1/4 of the thali should contain protein rich foods, okay, like egg, like boiled chicken, it could be fish, it could be pulses, dal, soya, and 1/4 of the thali should contain cereals. Like cereals should be whatever the staple diet the patient is taking. Actually, diet chart always be made according to the patient's socioeconomic status, cultural status, and the economical status. It should be based on the economical financial condition of the patient, which patient can afford. So 1/4 of the thali should contain cereals, which can be wheat, rice, maize, bajra, jowar, and 1 serving of the fruit and 1 serving of the dairy product. Mother should at least have 1 serving of low fat sugar free yogurt, curd, milk, 1 serving of fruit, at least 2 to 3 healthy midday snacks, and 1 to 2 carbohydrate serving can be taken in midday snacks.